Sawadee. Good morning to everyone. So, welcome to Risk Communications world. So, I would like to share to you all of the risk communication in Thailand. First thing, I would like to tell you about the objective of my presentations regarding COVID-19. Today, you will know about and aware of risk communications. The second thing, you will be familiar with the social stabilization by risk communications aspects of or demand on ecosystem public health emergency, especially for COVID-19 outbreak. And you will be capable to knowledge about and also aware about population, including collaboration with related organizations, for example, to work to ensure preparedness risk communication for mitigate and protect social from rumor and misinformation affecting the ecosystem health and public health emergency event, especially for COVID-19. So during the emergency, during the outbreak of COVID-19, the high demands of information will occur, which you need to respond in the urgence, require the risk communication and effective of the disseminations. And you need to prefer many of the channels for the key audience, for example, like a mainstream media channels and also for our social media platform. And you need to set up the sharing network, and you have to use existing information sharing network, and also you need to finding out or set up the new media channels, which is not non-traditional media. If you did not do like that, you will be faced of the misinformation and also the rumor occur in the social. And if the rumor occur, it means the panic will be occur and social stabilization will occur too. So in case of communications or the communicable diseases occur, for example, like a COVID-19, you will be see the curve, this is the bell curve. If you do not anything, it means the case or the rumor or the information will be spread out in the community. If you still listen or do not anything, the case, the death, and also the rumor, misinformation, and the fake news will occur. In those times, opportunity to control the situation and also for the rumor will be less. In case of you rapid response, both for the disease control and preventions, including risk communications, you will be controls the situation, you will be controls about the disease and also for the rumor and also for the panics of the social. This slide shows you about the case of the confirmed COVID-19 global-wide. You will see many of the area in the dark red. For example, like America, Latin America, and also in some parts of the India and in the Southeast Asia too. In this slide, you will see the new case of every area in the world. The big area you need to concern are America and India, including by now South Africa is very concerned because of the new case is a huge number. These the situations yesterday. For today, many of case, many of the new case is reported. Today, the confirmed case will over 19 million case, including for the 70,000 dead case too. During the public health emergency, people need to know about their health risk, what is or what are they are facing, and what action they can take or they need to do. They need to protect themselves and also for their love and their life. I will tell you about what is risk communications. Regarding to the WHO meanings, risk communication refer to the exchange of information, real-time informations, advice, opinions between experts and the people facing threat to their health, economies, and well-being. For the WHO meaning, they more concerns about touch, announcing information in the early of situations, transparency informations to inform the public, and also you need to planning in the normal situation before the outbreak of crisis situation. Regarding to the US CDC, United States Department of Health and Crisis, they also refer to an interactive process of exchange of information among individual groups, institutes, often involves about masses, opinions, or reaction to risk masses. So for the US CDC, they are concerned about you need to risk communication. You need to launch about the communication in the first of the situations. The information you inform the public need to be live and be credible. You also need to concerns about the empathy to the victim, promote and actions and show respect to the audience to inform them. For the communication theory of Berio, SMCR, S meanings about the sender, M is a message, C is a channel, and R is a receiver. During communications, the sender have to hit their goal. For example, in case of the COVID-19, if you would like to inform the public about the public needs to cover mouth and nose with mask, need to physical distancing, and also frequency hand washing, if you tell them that. In case of the receiver, they got to message, they get to message and know what they need to do. So they cover mouth and mask in case of they going to the publics. They are physical distancing or social distancing, including about frequency hand washing by water with soap or with alcohol gel up. So it means you hit the goal, and also for the receiver, they get the data and what to do. Be careful about risk or manage about the conflicts. In some cases, many of the people, many of the population, they will be confused, and also they will be against about what you're talking to them. For example, like a mask carrying, like a mask. Sometimes they will be said about the mask is very expensive and it's difficult to catch it for it. So you need to tell them if they could not finding the surgical mask, they can use cotton mask or wood mask instead for it. The keywords you need to know before your risk communication. The first things about risk perception. Risk perceptions mean people, officer need to know about the risk. How about the perceived risk? For in the case of COVID-19, many of the specific experts said maybe Thailand is the second ranks of the main outbreak of COVID-19, but by now we are in the more than 100 ranks of the world, for example. The second thing, risk communication, I told you already. The last thing is about risk management. In case of emergency occur, you need to manage the risk and also manage to the people perception too. Regarding Dr. Peter Sandman, the specialist of the risk communications, American specialist, he divided risk to be two things. The first thing is about the hazards. The second thing is about our threat. For the hazards, is the objective technical aspect to the risk, the priorities and extent of them as possible. For example, in case of COVID-19 is the COVID virus. And for the outthreat is the extent that people are upset, frightened, or angry, or do something to against to the public health recommendation. In case of hazard is low and outthreat is low, you just like a health promotion to inform them to do something. For example, like HIV/AIDS day, dengue fever day, rabies, World Rabies Day. In case of the hazard is low, but the outthreat is high, you need to manage outthreat. People excessive concerns about small hazards. For example, like in case of Ebola occur in the West Africa, but people in Thailand, they are fearing the African people who visit Thailand. So we need to inform them about the risk is very low, just protect themselves from the other disease. In case of the hazards is high and outthreat is low, you need to precautions, you need to advocacy to grabbing the attentions of an uninterested audience to arouse public concern and motivate precaution taking. For example, in case of tuberculosis, by now the mobility and mortality of the tuberculosis is very high, but people in the social, they are not concerned about TB or tuberculosis. You need to inform them frequency, more and more about cover mask, avoided to going to the crowded area, for example. In case of the hazard is high and also the outthreat is high too, you need to launch crisis communication because people are likely concerns about the genius threat regarding to communicate. COVID-19 is the good example for the crisis risk communication. The important thing is you need to concern people perceive the risk is different. They are perceived about the risk is not the same. For the officer perceive risk is higher when the hazard is higher or the mobility or mortality is high. But for the publics, people perceive the risk is higher when outthreat directly impact to them or is nearby them or impact to their family or their life. But the last thing you need to more concern because of the media perceive. Sometimes the media perceive maybe harm to you, harm to the publics, because the media, they are not concerned about the outthreat or about the risk, but they will be harvest outthreat and situation. For the risk communication capacity, you need to better utilize existing communications intelligence, including media monitoring, social media monitoring. In Thailand, we use the health hotline, we call 1422 hotline to identifications about the risk and also for the people perception too. And you need to launch launch about the risk perception survey or research. Because you need to first to secure social stability by single spokesperson, we call single voice, health professionals, general public media, minimize irrational fear or panics, instills and maintain public trust and confidence. So for the risk communication, the first thing you need to set up the specific message for each target group. Because of the target group, the target audience, they will perceive about their world, so different messages, different target. The second thing, you need to develop multiple media platform, media format. For example, like a infographic, like a graph, like a video clip, like a spot. You need to release all of the media to both mainstream media and also for the social media platform. Do the single citations. In Thailand, the single citations for the situations and for the informations come from Department of Disease Control. So the other or the related department need to use Department of Disease Control information and data. Spokesperson need to decide it at the central, regional, and provincial to inform the public and also for give information to the media too. Press conference need to set up at the central levels, and also for the in Thailand we have the CCSA, the Center of Command Situations for COVID-19 situations administrative regarding to the Prime Minister. Press interview need to set up in all levels, depend on the issue at the central, regional, and also for the provincials. Event-based risk com. I will give you more details about event-based risk communication later on. In this slide is the Department of Disease Control Incident Command System. Risk communication here at green box. Risk communication work closely and related to the operations or we call joint investigation team and also for the commander and situation awareness team. In Department of Risk Control, we set up hotline 1422 is the part of EOC too. In case of the situation occur, we need to evaluate all of the things, listen, detect, evaluate by intelligence team, media and new agency contact, advisory team, and expert. We also set up about response strategy to set up talking point, disseminate informations, legal measure, engage partner, for example. About the implementations, we send information to the social media and also mainstream social media, link to daily press conference, and also inform the public by hotline 1422. After publish the information, we also monitoring feedback, reaction, and also people perception too. The risk communication problem will occur when the message is not what the audience want to hear. For example, if they would like to know about how they can reimburse or how they can subsidize by the government 5,000 baht per month, but we give them information about the COVID-19 situation, they will be said, no, I don't would like to know about that. I know exactly, but I would like to know about when I got 5,000 baht. Is purple present, for example, is poorly presented, for example, like if you would like to inform the young people, you inform them by television, maybe they will not reach information. You need to send the information to them by, for example, like a Twitter, TikTok, Facebook maybe. is in purple come from the long source and is sent via the long channels. So I would like to give more details about event-based risk communications. I call MTCCTE. The first M is about monitoring. Monitoring what? Monitoring is about information which published by the mainstream media and social media. This graph will show you about monitoring newspaper, graphics, websites, publications, television broadcasting, and also people call 1422 about COVID-19. The purple color bar chart is the all of the news, and the red one is about COVID-19. Purple is a total. The last one is a COVID-19. The green one is the news or information published by Ministry of Public Health. You will see in the newspaper, the total is very high, but for the COVID-19 is not too high. But for the publication by the MOPS is also the quick same. It's the quick same to the websites and television too. For the television, you will see the red line, and also for the green line is the similar. So it's been also of the television, they publish the information from the Ministry of Public Health and also for from CCSA. Sorry for this slide because I could not translate from Thai to English, but I just would like to show you the details of the people call 1422 about COVID-19 since the 1st of January. We monitoring about people call. You can see many peaks of the people call. The first peak in this situation occur during the second or the third case in Thailand. You see the second peaks during the outbreak regarding to the boxings and also for the, and by now many of the because of the Thailand lockdown, also of the, for example, like Bangkok, and by now the numbers of the people call is low, very low. Not just for the Thais and for the English people or people who use English language, but also we concerns about the neighboring country people too. We set up the 1422 hotline for the migrants. We set up Cambodia, Lao PDR, Laotians language, and also Myanmar for give information to the people from Cambodia, Lao PDR, and also Myanmar. This is the slide show you about information monitoring from many of the source. This picture is from the televisions and also websites and newspaper. This picture is from 1422, and also here is from website and social media platform. Why we need to monitoring about information published in the mainstream media and also for social media? Because when the rumor, when one rumor occur, it will be or is a ghost viral. When it's ghost viral, it means it's not really difficult to stop it. Some research said about when the rumor occur, it's been the rumor or the fake news will likely to be repeat 70% said than the facts. When the rumor or the fake news spread in the Twitter is 6 times faster than the truth. So why we need to publish the truth frequency and more than the rumor and to control the rumor. When the rumor did not occur, you need to monitoring and prevent by sustain information society the truth and transparency. When the rumor occurs, you need to stop the rumor immediately by provide society the truth and transparent information by the credible people. For the mitigation rumor, proactively put out the facts and keep message short and clear. Do not counter directly, because if you counter directly to the rumor, it will be led to the repeating and reinforcing for messages. When the rumor occurs, you need to bombard all of the information, the truth and transparency informations in all communication channels, mainstream media channel, and also for social media platform. The second of the event-based risk communication is the truth and transparency. The T, I told you already, is about the health risk, so I will be captioned. I would like to inform you about the truth and transparency is related to the number. The concepts of the Baruch Fischoff, the number. When you have to risk communications, you need to get the number. The number should be right. For example, how many cases, how many deaths, how's about the details of the case and the deaths. You have to tell the public about the number. The real number is not some number, but you no need to tell them about the details of the patterns, the details of the confirmed case, but just tell them the number. For example, for yesterday, Thailand has 7 confirmed cases. Some of them come from Egypt, some of them come from USA. But no need to tell them about from USA, who is she? So you need to explain what we mean by the number, higher, less, or is dangerous. Show them they have to accept similar or is different from the past. For example, the COVID-19 is a new one. So if the past, you can compare to the MERS-CoV or to the SARS is the same virus, coronavirus. Show them that is a good deal of, for them and treat them nice, make them as a partner. The third of the event-based risk communication is a C. C, you need to designation about the content. The content you need to learn, because of when the people they hear something, what we inform them, sometimes they are not understand the same what we are saying to them. They heard something, but they did not hear everything. So sometimes they will guess what they are hearing, and they will be tell the others about what they are hearing. Monitoring is every step. It will let the major change at the end. So when you are sending the message to the public, you have to concern, should be the 8C is not 7C, sorry for that. The first thing is about clear, the message be clear about goal and your message. What is your purpose in the community? If you are not sure, then the audience will not sure too. Minimize the numbers of ideas in each sentence. Make sure that it's easy for the audience reach it, or the simplified of meaning. The second thing is about concise. Stick to the points and keep it brief. Your audience does want to read the long sentence, so they will be concerned just a short, concrete. Your audience has a clear picture about your tell them. You have to concrete about your information. Collect. When you communicate to the public, the information should be correct. Coherence is a logic. All points are connected together and relate together. If relate together, they will be believe you. Complete. When you send a message to the public, your message need to complete in all sentence, in one sentence, for example, and let them to know how to take action. Courteous. Courteous communication is friendly and honest. If you order them to do something, maybe they will not follow you. But if you ask them to do something, maybe they will be follow you. And the last thing I did not put in this slide is about the cultural approach. You need to concern to the cultural, the religions, and about the people lifestyle, because something is if the message or what they need to do is not proper to their cultural, maybe they will be not follow you. These are, for example, the press release with MOPH sent to the mainstream media and also for social media every day. This also for the information of infographics regarding to the COVID-19. These infographics is many of the language, for example, like Thai, English, Myanmar, and also Chinese. We also set up many of language modalities to inform the people who are living in Thailand, not just for Thai people. The other C is about the channels. As I told you many times, it's about you need to concern the main stream media and also for the social media. You need to concern for the old-fashioned people and also for the new one. In this situation, for the risk communication regarding to COVID-19, we are set up the new channel, the new social platform to inform the public about COVID-19. 6 social platform, Line account, Twitter, Facebook, TikTok, IG, Instagram, and also for the YouTube for appropriate to the specific audience. This is the slideshow used about we publish the information to the social media platforms in the beginnings of the situation. Line, Twitter, TikTok, and also IG. Facebook is very famous in Thailand. We have many of the followers. We will be catch the million in the near future. It is a line, official line, the channel which we send the information to the people and also to our officer in Thailand too. For the T, those building timely and appropriate frequency. For the T, the voice should come from the task source. Why we set up the spokesperson? Why Dr. Tavisin is the spokesperson for the government? At first, Dr. Tavisin, he is a spokesperson for MOPS, and then he decided to be the country spokesperson because we need to set up the single voice, the single citation. Stakeholder and partner communications. At the picture, the left picture and the right picture, which one do you think, who is the looking more credible and why? In picture, in your left hand side, maybe yeah, she is charming, but in your right hand side, Ministry of Foreign Affairs at the back is more credible. So in case of you need to press conference or like a press interview, you need to set up for credible to the spokesperson too. Other thing for the trust and transparency information is about engaging with the community. When you set up risk communication, you need to identify the people who at the community they are touched and have a good relationship with the people. So you have to finding them and make relation with them and involve them to support you to communication with the people in the village, in the community. Set up and integrate a team or working group to mobilization, health promotion, and community engagement department to support the people. In Thailand, for the engaging the community, we use the healthcare volunteer in the community. They are located in the community already. They are existing in the community. So we inform the healthcare volunteer, and then healthcare volunteer will be transfer the information about COVID-19 to the people. And also set up a mechanism to reach out of effective operation during health emergency. Okay. And another thing you need to concern about contact commissions about live social data and analyze on factor in the community. For example, like a language, living condition, regionals, religions, cultural, task channels, or communications, or influencer in the community. Because of in the emergency event, when you send some data to them, maybe when you inform the information to them, maybe they will not follow you. They will not listen to you. But in case of the local administrative tell them, or the health volunteer tell them, they will believe that. For the stakeholder and partner communication, you need to know your stakeholder and partner well and respect them in professional aspect and also personal aspect too. Sharing the truth and transparency information timely to them. Keep the key stakeholder and partner in information them frequency. Need to ask them which method, which channel, or which information they know, they would like to know, or they are easy to latch, or they are suitable to them to catch it. Support them, support their one identifies about their needs. Two-way communication need to be occur. Don't forget to let the stakeholder say what they want. Treat them good as a friend. Do not treat them as a subordinate. The last one is about the planning and evaluation. This shows you the plannings of the risk communication regarding COVID-19 in each situation. For example, like a situation occur in outside country, and we have the suspected case in country, found the confirmed case and outbreak in the country. In Thailand, we also launched about a quick survey regarding COVID-19. For the quick survey, we questionnaire, we said the questionnaire 75 points about 3,500 questionnaire 4 times, and also for the survey online too, 14 times. So this what we found is about the people perception regarding to wearing masks, to like a social distancing, physical distancing, hand washing, for example. So when we know about the perceive, we can set up the risk communication procedure or information proposed to their perceive. So this is my summarized slides for the risk communication key success. The first thing is about policymaker. The policymaker need to understand the job, the responsibilities of risk communications. All of the procedure of risk communication they need to know, because of the policymaker need to support about the policy and also to support about the budget too. And for the risk communications work, is very hard work. You know, for the risk communication team, we worked at the first of the situation since the third of the first of the January to now. We still work. Some of them they are work 24 hours. For example, like a 1422 hotline response. So moral support is very important for the officer by the policymaker. The second part is about the officer, the risk communication officer. They have to proactive. They have to love and learn everything all the time. They have to continuing learning both situations and also knowledge regarding COVID-19 and also for the other aspect. For example, like the law, like about travels, about state quarantines, about how to submit or how to ask the embassy to go to Thailand, for example. The most important for the officer is they have to love and pay attention of risk communication. As I informed you before, risk communication work is very hard. We have to monitoring all of the things all the times, and we have to respond everything immediately in case of the panics or the rumor occur. The last things about the media and the stakeholder, good relationship and public the truth is important to them. You need to do early risk communication to the public. Don't delay. If delay, the people will say, you are conceal something, you are cover something, you are lie something. So you need to inform the public at the earliest of situation. The second thing is about identifies and investigations about the risk and the people who are at risk and inform them at the early. Show the data and explain what happens and how to deal with situation. For example, in case of Rayong province, they are very panicked because they don't know, they did not know what happened and how to deal with the situation. So we need to inform the detail, more detail, and ask them to do something. Good spokesperson is very important, the most important, because of what? Because of if spokesperson is credible, or if the charming, or if they can speak something and people believe them and follow them, is good for you, because of panics and rumor, misinformation will not be occur. Spokesperson, authorities and officer need to set the same number, the same situation, the same detail. If the spokesperson said, today they have 7 confirmed cases, but authority said, have 10. If the officer said, just 2, it means untouched will be occur, so the people will not believe the government office again. Close contact with the media. You need to make the relationship with them, send them information every day, and look at them as a friend, not enemy. Real-time risk communications. So why I tell you, I inform you more frequencies about why we need to evaluation or identifications about the people perceive, because risk communication need to launch regarding to the people perceive, and need to set up the plan, risk communication preparedness and emergency plan too. Don't say no comment, don't say that. If you say no comment, the media or the public, they will be finding other source. If they're finding the wrong source, it means the misinformation and the rumor, the fake news will be occur in the social. Don't resist existing situation. For example, by now we have many of the American soldiers visit Thailand to exercise something. We need to tell the public about we have the American soldier visit Thailand for the exercise with the Thai army, for example. Say it's not my duty. Everything in Thailand, everything in public health or everything related to the COVID-19 is your duty. But depend on how about yours, tell the public. Actions more than or less than situation. Escape interviews or question, because of if you escape, it means the media or the public will be finding other sources. Tell the media it's not secret, concealed, it's not public. So it means the next or maybe the tomorrow, your word will be at the first page of the newspaper. So you tell them the truth and transparency. So for the risk communication officer, you have to calm but alert. Calm is mean you know everything, but prompt to respond to the situation. Relax but ready. Relax is mean not fear, because if you fear, you panic. The audience, the public will panic too. Smooth but sharp is Berio. You know everything, but you are calm, you are relaxed and smooth. The last thing is about humble but confidence. Humble is a very good characteristics of the risk communication. You have to teach your audience good, treat them good as a friend. So risk communication officer know everything, but do speak just in your duty and responsibility only. Thank you very much. Questions and comment, please.
Thank you very much, Dr. Prahurat. So it's very fruitful the talk, sharing the experience that you have. I think we have one question from the participant. Does Thailand have any problem of people refusing to wear masks in the public?
Yes, we have many of the people, they are refused to wearing masks, but we have frequency to inform them about mask is like a can protect them from infected. And we found many of the people, they are trying to wear masks, but it's difficult to finding out the mask in the beginnings of situation. But by now in Thailand, we have the very good producer. We make the mask from cotton. By now, many of the people in the public, they are wearing masks. We no need to let's say
it's more like a social norm now. If you don't wear, you look like a stranger that you not really protect themselves or your colleagues or your family.
Yeah, many of the country, they are findings, or they are fine, or they are use the legal to enforce the people to wearing masks. But Thailand, by now, we don't need to enforce by law, but we just use social sanctions and also for social norm. In case of the people, they are not wearing masks, every people will look at them as a sanction. Yeah.
I may share my experience. The condominium that I stay, they post it, if you not wear the mask in the public area, you will be fined by the, let's say, the legal person at the condominium. But in general sense, the public bus, like right now, they request every passenger to wear the mask to be able to be on board.
Yeah. Me also, last week, I have to took the plane from Bangkok to the south of Thailand. A man, he would like to enter the airport to take the plane. He did not wear the mask. The officer said, you have to finding mask first. If not, you will be allowed to go to the airport, for example. So it's good deal because of if you're not wearing mask, it means you will be not allowed to go into somewhere. Yeah.
So there are two more questions. The Christy from Nigeria, she asks, how safe is the closed nose and face mask?
How safe?
How safe? They believe that they can protect the self-made cloth mask.
How the mask can protect about the infectious? Okay, so in Thailand, we inform the public is if two people they are not wearing masks, it means 50% there will be infection. If some people, if other people they are the confirmed case. If one people wearing mask, the percentage of the infections will be decreased from 50% to be 15%. If two people they are wearing masks, it means just 5% will be sick, for example. So in Thailand, for the cotton mask, it's easy to buy these here and difficult, beautiful, and you can find the
design cloth something. But I think the government really provide the standard that you have to put the filter things and then can change it every day. So I think that another one question, how do you handle harassment of the health official promoting public health policy through the social media platform?
For the
this case is not happen in Thailand.
No. In this case, it's not happen in Thailand because of as I informed you about the single message from the single citation. So we not found that, but we are still monitoring and if we found that, we will be respond immediately. In Thailand, we are really lucky because we have relationship and co-relationship with other ministry, not just for the public health, also for the Ministry of Digital and Technology. They are also support us to monitoring about the embarrassment, fake news, rumor, misinformation occur in the social media too.